Good morning. I am here with Clea today, and we are working on her leg veins. And I have the same problem. I've been working on my leg veins for years, but Clea just has little teeny spider veins. Is that right, Clea?
Yes.
Where are the worst ones?
Worst ones are going to be on my left leg.
Okay, so let's see. Oh yeah, you do have a little cluster. Okay. So now with leg veins, there's three layers of leg veins. There's the deepest layer, which is the biggest ones. Then you have the medium depth layer, which is in the center part of the skin. And then you have the superficial ones. And we at Contour Dermatology treat the superficial ones. Now, if you have big ropey ones that are popping out of the skin, that's going to be a deep vein. If you have the purple ones that are kind of below the surface, those are going to be the reticular veins. And then these, of course, are the superficial veins. Now, this treatment, we use glycerin. I like glycerin because it's very safe. It also doesn't sting and burn like the other ones. And it doesn't cause ulcerations like some of the more aggressive ones can cause. So we're going to just see how nice this treatment is, because hopefully they'll be easy to penetrate and eliminate. We sell treatments for the superficial veins in packages of 5 because typically it takes more than one treatment to get rid of them. And this syringe is loaded up with the glycerin. She's been wiped down already. And so then all we do is we just put the needle underneath the skin like that, and then we inject. And you can see how nicely that goes. Now, it's very satisfying to do it, but they're not going to completely disappear with this treatment. All it's doing is it's irritating the blood vessel wall, and then that'll cause clots to form and the vessel to disappear. Now I'm in the other one, and you can see how that's causing a lot of the blood vessels around it to disappear. And then we'll get into, this one's a little bit deeper, so I'm going to have to go a little bit deeper here. You can see that one even causes the blood to disappear out of those veins. Can you see it moving around? Mm-hmm. And you don't really see a result for a couple of months. The aftercare for this is we like to wrap the legs for 24 hours. Lady who does mine doesn't wrap at all. So she tells me I only need it for an hour. But I actually like to wrap for our patients. And if we find that this isn't working, we will send her over to get a deeper vein evaluation. They use an ultrasound to check for incompetence of the valves, because the blood vessels have these little valves that keep the blood or help to push the blood up towards the heart, or keep it from not going up towards the heart. Can you see these, you guys? And then we're gonna do this one right here. And Clea, can you roll over a little bit more? Perfect. And we want to treat those deeper veins first if that's a problem.
That was a good one.
You got that one? Good. Good. The treatment typically doesn't take that long. I've been doing it for so many years. It takes me maximum of 10 minutes to do a whole area. Oops, sorry, Clea. Do you have any on the other side? Or is it just this side?
She had one by the knee on this side, a little bit behind it.
Okay, and let's lay her on her stomach if you don't mind, because I really want to get, we have to lay her flatter because she's going to break her back if we don't get comfortable. I love doing leg veins, they're very satisfying. And Clea has the perfect veins.
On my stomach.
Okay, and let's get on this side. How's the pain, Clea?
Not.
Oh, look, we've got a bunch over here on the back, too. These are really good ones. So we should be able to get these. Yeah, I think you have some of the easiest vessels to treat. Yeah, we did on this treatment, because you can see the little holes where we went into them. Okay, so for those people, a lot of people ask me if we can do this on the face, and the answer is you can, but because of the fact that it could cause ulceration, I really like to use the lasers on the face, because the lasers are just really effective and you don't have as many risks with it. A lot of people want to use the lasers for the vessels on the legs, but it's really not as effective as we would like it to be, because the veins are superficial and then they dive deep. And so, so we can't actually laser enough of the vessel to get rid of it all. Because you see this, when we inject it with the glycerin, it's tracking all along the blood vessel. Sorry, Kalia. It's tracking all along the blood vessel. And so it's irritating the whole vessel wall, whereas with the laser, you're just treating segments of the vessel, so it doesn't really work that effectively. Okay. So we got a lot of coverage with the vessels on Kalia's legs. So we'll be doing it once next month. So we'll be doing it once a month until we see some dramatic improvement. And hopefully we'll see some improvement with this. And then let's get this little guy right here.
Doctor's on the wall.
Mm-hmm. Sometimes it's hard to get into a vessel. So if you just keep trying different, there we go. See, that one's good. So you just keep trying different angles until we get the whole thing. So Kalia, you are a champ, and let me just see the light. I'm gonna use a vein light to see if I can get anything deeper, because this one looks like it might be feeding from all the way down here.
Oh, that's cool.
Because if we don't get that deeper one, we're probably not gonna get it. Alrighty. So that's all there is to it. How was the pain, Kalia?
There was none.
None?
No.
So she had a 0 out of 10 in terms of pain. So thank you guys for tuning in and watching leg veins get treated. If you have problems with vessels, please contact us here at Contour Dermatology, and we'll be happy to help you out with that. And we also want to thank you for your support on YouTube, where we've grown by, what is it, 32%, Tyler?
Yeah.
In the last, how many months?
3 months.
In the last 3 months. So thank you for tuning into our YouTube channel. Have a great day, you guys.